Hello, everyone, and welcome to the 2023 CADTH Symposium. I have to admit, it's been a long time getting to this point. It's almost 3 years ago since I've joined CADTH, and I've been looking forward to attending an in-person symposium since I started. While it's taken longer than I hoped, I think it was well worth the wait, and I hope that's how you all feel at the end of the symposium. In addition to just thanking everyone for being here, I would like to recognize that I have the distinct pleasure of speaking in front of two former CEOs of CADTH, Dr. Dave Mendez from Alberta and Dr. Brian O'Rourke. So thank you both for joining us today. It is wonderful to see so many familiar and new faces, and it's very important for us to welcome those who are joining us virtually. When we started out on this journey to host the first in-person CADTH Symposium, we really did struggle a bit to figure out how would this all work with a hybrid, how many people would come in person. I'm pleased to say that our registration just peaked over 1,000 individuals in the last couple of days, and there were over 650 people participating here in person over the next few days. Before we start into my formal remarks, I would like to begin by acknowledging that I'm speaking to you today from Ottawa, located on the traditional unceded territory of the Algonquin and Anishinaabe. Thank you to the Algonquin peoples who have been the keepers and stewards of the land that I'm standing on today for thousands of years and over many generations. I feel very fortunate to call the Ottawa area my home, but I've also had the pleasure of traveling across this beautiful country and seeing its beauty from coast to coast. People are joining us today in person and online from various locations, and I'd like to encourage you all to think about where you live, work, and play. Take a moment to acknowledge the people who have and continue to care for and sustain the land you call home. So, the topic for this symposium. I've seen everyone looking through the book. The topic is really about change. Change is the only constant in life. Although you've likely heard this saying before, it's especially true given the experience we've all had over the last few years. We've all had to navigate the ups and downs in our personal and professional lives during this very deeply uncertain and troubling time. The pandemic has tested our abilities and sometimes our willingness to change. Rather than focusing on the pandemic today, I'd like to talk about the changes that it's brought, the lessons that we've learned, and the opportunities for the future. Although it's been difficult, our recent experiences have taught us valuable lessons that will help us move forward, and we now have the opportunity to take that knowledge and put it into action. It's time to think differently because the people living in Canada expect us to meet this defining moment and respond differently. The post-pandemic pressures of staff shortages, backlogs, health workforce burnout, rapid digital innovation, and uncertain economic environments are very real. Make no mistake, the challenges in front of us are enormous. The questions we are asked are complex, and the stakes are very high, no matter where we are. But together, we have the power to harness what we have learned and apply that knowledge to shape future-ready health systems. Our world has truly changed. The world is different than it was 3 years ago. Our society has changed. The world of scientific evidence has changed. And COVID has undoubtedly changed our health systems forever. One of the most positive changes that I've seen is a real, intentional, and greater focus on equity, diversity, inclusion, accessibility, and reconciliation. The pandemic exposed inequalities in vaccine access and in other important health services, and there were populations that were disproportionately affected. These are sobering realities, but to be frank, they aren't new. But what is new is the urgency and commitment that we collectively feel to make meaningful change. Our increased understanding of the disparities in health and social care is driving many organizations like CADTH to do better, because everyone should have timely access to safe and effective health care. To provide this, individuals, clinicians, health systems, government decision makers all will need to make difficult choices. And health technology assessment, or HTA as it's referred to, can help provide more equitable care. So what is the value of health technology assessment, or HTA? HTA can help create greater equity in decision making. Rather than basing advice and decisions on the loudest voice in the room, the best marketing campaign, or what somebody thinks, HTA provides a more inclusive, impartial, consistent, and transparent way to inform those important decisions. Using evidence, including HTA, to inform decisions is more important than it's ever been. Evidence has always been at the heart of decision making, but it is now much more visible to the public, who continue to have questions about the scientific process, among many other individuals. Researchers, academics, and evidence organizations around the world have recognized that there is a new emphasis and value placed on the work that they do, day in and day out. The intersection of evidence, products, and services to public policy is key to making informed decisions. Part of sound decision making is having the right people at the table, especially if we're going to create health systems and health system needs for the future population. And in Canada, that requires us to recognize that significant participants in the health system of the future will be Indigenous voices. And those Indigenous voices are welcome to help us understand how to approach, how to prioritize, and determine what and how advice that's being provided about them and their communities should be considered going forward. We're fortunate to have partners from Pipiquan-Petaquen who have been guiding us, and you'll hear more about that a little later this morning. CADTH, like many other organizations represented in the room today, are navigating how do we move forward on our respective journeys to reimagine and embrace the critical need for Indigenous perspectives in healthcare systems of the future. Along with the shifts in equity, diversity, inclusion, and accessibility, perspectives on health technologies have also changed. The unprecedented development of digital health technologies throughout the pandemic was quite honestly astounding. And the rise in use of real-world data has been critical to the fight against COVID. And I'm proud to say that at this symposium, CADTH's work on the guidance for reporting real-world evidence is being launched. So if that's a session you're attending, I hope you look forward to it. The pandemic has accelerated the possibilities of virtual care, which have reduced barriers to care, including in remote communities. As an example, last year's mini MRIs were introduced, meaning doctors can detect issues like stroke at the point of care without having to medevac and transport patients to larger centers in some cases. And this is just one example about how health technologies have the power to transform our rural and remote communities. COVID has brought on significant changes, but it has also provided lessons that will help us move forward in this daunting, critical time in healthcare. We have learned valuable lessons, some of them good, some of them not so good. We have learned, though, that collaboration is and will continue to be key to solving healthcare crises. It has reinforced the importance of capacity building across the system, from the beginning where people are starting to think about innovations, through the life sciences, through the regulatory, through health technology assessment, and all of the important pieces that get discoveries from our life sciences sector into the hands of those individuals who can deliver care and make a difference on behalf of patients, for patients. We must focus on agility to better respond to the changing regulatory environment while ensuring that we continue to provide the best evidence-based advice. We need fit-for-purpose evidence, meaning that evidence that is equity-weighted, integrated, multidimensional, timely, and policy-sensitive. And we can only do this together. None of us holds the individual key. We recognize the need to listen, to communicate more clearly, to value relationships, and to collaborate, not just with people that we have done so in the past, but all collaborators. There are many new people that we should be collaborating with. Partnership is a guiding principle of our strategic plan, and I'm proud that we have partnered with Indigenous leaders, patients, and clinicians to make our work better, more impactful, and relevant to the people who use it. Patient partners are critical to our success, and we are thankful to them for sharing their lived experience, their advice, and pushing us to improve the quality of our assessments of procedures, devices, and drugs. We need to be successful together for patients to be able for them to have access to effective innovations, not only during a pandemic, but whenever they need them, wherever they need them. We can continue working together to improve health, but how do we plan for a future-ready healthcare system? And really, the future is up to us. We have a brilliant group of people in the audience today. Imagine what we can do together. There are many challenges, healthcare leaders today facing more disruptive innovation, more demands on their limited resources, as well as greater expectations, as there should be, that to empower patients to take ownership of their own care. Although some days it seems overwhelming, there are so many opportunities to move forward and thrive in the face of uncertainty. I joined CADTH, as I said in my opening remarks, in 2020, and I have seen considerable change over the times till now. We are definitely different than we were before, and we will be different a year from now. The same is true for the organizations where we all work. CADTH, like all of you, is an evolving organization, along with an evolving drug and device decision-making landscape. Our strategic plan is designed for the future. Anticipate, innovate, and transform are its three pillars, which are especially important today. It's clear that the transformations are necessary to keep up with the pace of change in technologies and our world. This symposium will bring together Canada's vast network of the brightest minds that includes patients, patient organization, government decision makers, clinical experts, researchers, leaders in the life sciences field and technologies, private insurance, and global HTA experts. Together, we learn and challenge each other to understand how health technology is going to change how we deliver health care. What will the next 5 years look like? The next 10? Will the new innovations and technologies help us with our health care, or will they bring on more challenges? Maybe both. Everyone here today has capabilities that will make the future of health systems better. Everyone in this room brings expertise and in their own experience that is valued as we look ahead. We have seen remarkable progress and learned important lessons about what not to repeat. These successes and learnings, because we have worked collectively towards a specific goal, are a key element to setting us up to success in the future. We must continue working together to overcome traditional barriers and be forward-focused. At a recent CADTH leadership event, we were challenged to really define, are things dangerous for us to do differently, or are they uncomfortable and cause us discomfort? It is our job to push through things that are uncomfortable for us. We can't improve our health system in silos. And let's be honest, it's not just governments that have silos. We all do, and we need to recognize that and break through those with collaborations with one another. Together, we have skills and experience to shape the future of health, a future that uses evidence to channel hope into action. The future is now, and we can start today. Thank you. Merci. Miigwech. Now it gives me great pleasure to introduce our first speaker, Dr. Stephen Lucas, Deputy Minister of Health Canada. Dr. Lucas was appointed Deputy Minister in 2019. Under his leadership, Health Canada launched a comprehensive response to COVID-19 in collaboration with the Public Health Agency of Canada, with his colleagues in the federal, provincial, and territories as well. And he was supported by leading scientific experts, which contributed to the largest immunization program in Canada's history. Before joining Health Canada, Dr. Lucas served as Deputy Minister of the Environment and Climate Change in Canada and Deputy Secretary to the Cabinet for Plans and Consultation and Intergovernmental Affairs at the Privy Council Office. Bienvenue, Dr. Lucas.
Thank you, Suzanne, and good morning, all. I'm really pleased to be speaking with you today to open the 2023 CADTH Symposium, and it's great to see everyone here in person for the first time in a few years. The symposium is a marquee event for attracting a diverse range of perspectives on the role and management of health technologies in the healthcare system. Je tiens à remercier Suzanne et la CMTS de m'avoir donné l'occasion de m'adresser à vous aujourd'hui. La participation témoigne de la capacité de la CMTS à réunir des experts de tout le Canada et de ses systèmes de soins de santé pour faire avancer notre programme commun. Santé Canada considère la CMTS comme un partenaire clé dans l'exécution de son mandat. Qu'il s'agisse de tirer parti de son expertise et de ses capacités sur des questions stratégiques importantes ou de collaborer avec nos organismes de réglementation et nos scientifiques à l'examen de règlements et de remboursement. Son travail contribue à aider les Canadiens à maintenir et améliorer leur état de santé. This year's theme, Shaping Future-Ready Health Systems, comes at a critical time. While it's important to look at and be ready for the future, we must recognize the current issues and challenges in the health system and how addressing them is foundational to a future-ready system. I'll not go into a number of lessons learned from the pandemic, but perhaps just note a few key words which I'll touch on through the course of my remarks, and we'll build on some of the points that Suzanne shared with you. Among them, the critical need for speed and agility in responding, the central importance of collaboration, the centrality as well of health data and evidence, and its timely accessibility. The critical importance of considering health inequities and inequities in access to the health system. And finally, the importance of looking at end-to-end approaches, such as was taken in the vaccination campaign and now more broadly in strengthening the biomanufacturing capacity in Canada. So building on those considerations from the pandemic, we certainly recognize that our publicly funded healthcare systems are facing increased and sustained pressures that were compounded by the pandemic, but have been building for some time. Whether it's the critical shortage of healthcare workers, patients facing long waits at the emergency department, or not being able to access those departments at all due to lack of staff, the backlog in accessing surgeries or diagnostics, delaying care for patients, these pressures individually and combined together are impacting on the health of Canadians and the care they experience, and more centrally, the care they deserve. External pressures such as our aging population and the increased costs for new and innovative health technologies further add to the challenges. Many of these issues are rooted in the fragmentation of our system, including lacking coherent approaches around the accessibility of patient health records and health data, including by patients themselves, and uneven integration of digital health technologies. Health data, including drug and treatment data, is vital to keeping Canadians safe and in good health. In the last 20 years, many aspects of our lives have benefited from technological advancements, from online banking to ordering food to talking virtually with our friends. As technologies evolve, healthcare systems too must evolve. Je vois d'autres pays où les personnes ont un accès complet à leurs propres dossiers médicaux électroniques, où ces renseignements peuvent les suivre entre les différents prestataires impliqués dans leurs soins. En Europe, des technologies et des politiques ont été mises en place pour qu'une ordonnance rédigée en Finlande puisse être exécutée en Espagne. Le contraste est saisissant avec le Canada, où de nombreux Canadiens doivent répéter leur histoire, spécialiste après spécialiste, et suivre leur propre historique médical parce qu'il n'y a pas de dossier électronique qui les suit dans le système. Il faut que cela change. Les Canadiens méritent un système de données de santé de classe mondiale. Nous savons que le Canada doit investir l'ère numérique ici, chez lui, pour s'assurer que nous modernisons nos systèmes de soins de santé avec des données de santé normalisées et des outils numériques, comme l'ont fait nos partenaires dans le monde entier. The pandemic has also shone a light on equity, and more specifically inequities, and racism issues in the health system, including continued challenges for Indigenous peoples. Persistence of health inequities prevent many people in Canada from being able to achieve their full potential. We need to build a more inclusive healthcare system that addresses these health and social inequities. In order to ensure the benefits of new technologies, the methods and processes of managing these technologies, including assessing their safety, efficacy, and their real-world effectiveness, will be critical to ensure sustainable access to health technologies into the future. This will require agility in approaching regulatory and health technology assessments. As innovation accelerates, Canadians expect their governments and healthcare system to keep pace. A future-ready system is one that supports the opportunity presented by new and novel drugs and devices with the appropriate and timely decision-making and monitoring processes that ensure the safety and efficacy of those technologies once deployed in the real world. So in the next part of the presentation, I'll speak to some of the measures that the government has taken to address these challenges and to build on the lessons learned in the pandemic. The government on February 7th of this year announced an investment of close to $200 billion over 10 years in supporting transformation in the health system, including $46 billion in new funding for provinces and territories to improve healthcare services for Canadians, and a new $2 billion Indigenous Health Equity Fund. Through both increases to Canada's health transfer and tailored bilateral agreements, we will work with provinces and territories to achieving better outcomes for patients. The bilateral agreements are focused on 4 shared health priority areas with the provinces and take overall a patient and person-centered approach. The first area is focusing on strengthening primary care, or family health services based on integrated team-based models in the community. Second area is supporting health workers from recruitment to retention to better planning and data and innovation in how care is delivered. Third area of focus is on mental health and substance use, critically important dimensions of the health system that were exacerbated in the course of the pandemic. And finally, support for modernizing the health system with a particular focus and commitments around health data and enabling the use of digital health technologies to support Canadians wherever they live in Canada. These 4 areas of shared health priority are complemented as well by investments the government has made to help Canadians age with dignity closer to home. I know that many Canadians will want to see the results of the investments they're making. And so an important element of this overall plan for working together to improve healthcare for Canadians with provinces and territories is not only on enabling Canadians to have access to their own comprehensive electronic health records and ensuring that that health information can be shared between providers and used for overall system management, evaluation, and research, but that the data is provided transparently so Canadians know how their health systems are performing. And we're working in close partnership with CADTH on this and on InfoWay with a recently adopted federal, provincial, territorial roadmap for interoperability to connect these systems. I'll now turn to a few comments on our biomanufacturing and life sciences strategy as another critical area of investment, as I said, to think about an end-to-end approach for supporting future pandemic preparedness and strengthening the life sciences sector in the country. La pandémie a également révélé certaines lacunes dans notre secteur de la biofabrication et des sciences de la vie, mettant en lumière la nécessité de renforcer les capacités du Canada en matière de développement et de fabrication de vaccins et de thérapies.
Pour se préparer pour l'avenir, le gouvernement fédéral s'est engagé en 2021 d'investir 2,2 milliards de dollars sur 7 ans dans la mise en place de la stratégie en matière de biofabrication et de sciences de la vie, qui vise à renforcer l'écosystème national des sciences de la vie au Canada afin d'être prêt à faire face à la prochaine pandémie. En outre, nous travaillons désormais sur l'ensemble des cycles de développement de contre-mesures médicales afin de mettre en place la possibilité de développer de manière plus efficace et rapide les technologies, par exemple les vaccins, les thérapies et les outils de diagnostic nécessaires pour faire face aux futures urgences sanitaires. We're also looking to build on flexibilities introduced during the pandemic in our regulatory system and make them available more broadly to support Health Canada's review of all drugs and medical devices. This includes taking the lessons from and building into our regulatory frameworks what we put in place during the emergency regulatory measures in the pandemic to be agile and very timely in terms of our approach to reviewing vaccines and therapies, while ensuring our ongoing standards of safety, quality, and efficacy are met. It was evident even before the pandemic that Health Canada would need to modernize its regulatory frameworks to keep pace with innovation in the products that we need to regulate. The pandemic forced us to adapt quickly and to turn to new ways of working, as expressed in the interim orders, which enabled us to facilitate earlier access to urgently needed vaccines and therapeutics to combat COVID-19, and to take the time scale, in that case, from reviewing vaccines from 2 to 3 years down to 4 to 6 months. Our experience with terms and conditions and rolling reviews under the emergency regulatory measures are informing the proposed amendments to the Food and Drug Regulations and Medical Device Regulations. The amendments will support an agile, modern framework to oversee regulated drug and medical devices in the entirety of their life cycle, and to allow Health Canada to better manage the risks and uncertainties of innovations for therapeutic products, thereby facilitating their access to them for Canadians. These proposed regulatory frameworks would build on the already considerable progress that we're making in improving the accessibility to drugs in Canada from the alignment of Health Canada and CADTH regulatory and reimbursement review processes. Ensuring Canadians have access to the best medicines is critical, as is making sure that Canadians can afford the drugs they require. Le ministère de la Santé a récemment annoncé des mesures visant à soutenir une stratégie nationale visant des médicaments pour le traitement des maladies rares, qui permettra d'accroître l'accessibilité et l'abordabilité des médicaments efficaces pour le traitement des maladies rares dans l'ensemble du pays. Grâce à des accords bilatéraux, nous travaillons actuellement avec les provinces et territoires pour améliorer l'accès aux médicaments nouveaux et émergents de manière cohérente dans l'ensemble du pays, ainsi que pour soutenir l'amélioration de l'accès aux médicaments existants et le dépistage et le diagnostic précoce des maladies rares. A pillar of this strategy for drugs for rare diseases is working with CADTH and CADTH to develop improved methods of collection and use of real-world evidence to support value-based decision-making about drugs for rare diseases. The impact of drugs in our health system extends beyond just drugs for rare diseases. Canada's patchwork of drug coverage leaves many Canadians facing significant barriers to getting the prescription drugs they need. To that end, the government has committed to tabling a Canada Pharmacare bill by the end of 2023 and advancing a plan to establish a Canada Drug Agency. We've heard about pharmaceutical system gaps, such as poor infrastructure and fragmented data, areas where improved coordination and collaboration at the national level could have significant impact. We've also heard of the high cost to people's health and the bottom line of public health systems of the inappropriate use of drugs. The Canada Drug Agency Transition Office is working with an expert committee to develop a national strategy for appropriate prescribing and use of drugs that will support patient safety and improved health outcomes. Further, it's worked with key partners such as CADTH, CADTH, and Infoway to bolster pharmaceutical data and develop associated analytics will help to gain new insights about the utilization and benefits of drugs in a variety of care settings. In conclusion, the pandemic has given us all, and given our health care system stakeholders and partners, many lessons, such as the need to modernize our approaches to generating and assessing evidence for decision makers and end users in a way that increases access and reduces risk and inequities, and that can be done in a timely fashion. New ways of working are warranted. As Suzanne noted, this is all about change. We should look to how we adapt regulatory, health technology assessment, and formulary listing decision-making processes that incorporate evidence across the drug or device's life cycle. As innovation accelerates, Canadians expect their governments and healthcare systems to keep pace. A future-ready health system is one that meets the uncertainty and opportunity of new and novel drugs and devices, with decision-making processes and monitoring to ensure safety and efficacy of these technologies as they enter the market, and their ongoing effectiveness and safety while in real-world use. Regardless of how we get there, our shared goals in increasing accessibility to innovative and effective health technologies, ensuring the sustainability of healthcare systems in Canada, and maintaining an appropriate regulatory oversight all contribute towards the goal of everyone at this symposium, improving the health of Canadians. For you here today at the symposium, whether attendees or speakers on the various panels and sessions, you're well placed to have productive discussions to help us better understand and contribute to what needs to be done to shape future-ready health systems. So with that, I wish you a very informative and productive 3 days of symposium together here in person in Ottawa and hybrid across the country. Je vous souhaite à tous 3 jours instructifs et productifs. Merci. Thank you.